Dr. Najan Dean, good morning, sir.
Good morning. Thank you for having me.
Glad to have you in here. And you're with Slocum Dickson, new over at Slocum Dickson.
Yes, I am.
Where do you come from, by the way?
I did my residency and fellowship in Syracuse at Upstate Medical University, and I've been here since September.
All right. So you like it here? Do you like it?
Yes, so
Utica
far.
area?
So far, it's been going good.
All right. Okay. So first of all, I want to talk about some of the changes and the opportunities. You are a hematologist.
Hematologist and oncologist.
Okay, so tell us what that means, by the way. The study, so blood, of course, I would get through the hematology.
So a hematologist studies the benign and malignant disorders of the blood, benign being anemia, low white count, high white count, low platelet, high platelets, and then if they are due to any vitamin deficiencies or any genetic abnormalities that sometimes we can look at and make the person feel better. And then the malignant are the blood cancers, so we can do tests for that and start treatment for that. And then an oncologist focuses on mainly solid tumors such as breast cancer, lung cancer, melanomas, kidney cancer.
And obviously, early detection is extremely important when it comes to having success in treatment, right?
Yes, in most of the cancers, if we can catch it early, it's a higher chance of getting the patient into remission and a cure. And there are a lot of different things that we can do to improve the rates of early detection. There are some cancers, such as colon cancer and breast cancer, where we have established procedures, and also cervical cancer, where we have established procedures to improve the early detection rate.
Yeah.
And the earlier we can get to the patient, the earlier the stage at diagnosis, the better their overall prognosis ends up being.
And last week the story came out with breast cancer and breast screenings, and saying that I was one of the medical groups out there saying actually that all of this screening actually is doing more harm to women. Do you agree with that? I would think that, and they're saying, because I'm sure you saw this in the news, but they're saying it's because we then sometimes treat the breast cancer that might have been a slow-moving breast cancer that didn't need to be treated.
So, looking at it with the same brush and looking at it without going into the details, can sometimes miss important points, such as what they might be talking about is carcinoma in situ, and there have been a lot of studies trying to see what is the best management for people who have carcinoma in situ, or if they have biopsies that end up being negative.
Right.
So the issue there is that we have there's data that if you can for ductal carcinoma in situ as well, if you there's now more tests that you can tell that whether this particular person actually needs radiation, which the main treatment for that, or she can be just monitored. But for anytime we go for a watch and wait approach, we have to be really careful that we do our due diligence to completely make sure that there's no evidence of any invasive cancer that can cause problems.
But I would think that getting screened is, I would not want to back off on the screening. If that would not be the advice I would give to my wife.
Yes. There's the issue that a lot of the breast cancers are palpated by the women themselves. So that might come off as that, what is the benefit of screening? But on the same token, a lot of breast cancer is caught by just screening as well, and those women generally do better than if they waited for symptoms or if they ignored any lumps that they were concerned about that weren't there.
All right. Talking to Dr. Najan Dean, who's a physician at Slocum Dickson, hematologist and oncologist. One of the things that, and we have a video that's up on our website at WIBX950.com, and you can check it out. Worth looking at as you really dig into this. But immunotherapy is something that you're offering over at Slocum Dickson now.
Yes, for a lot of different malignancies such as melanoma, bladder cancer, lung cancer, there are medications that sort of harness the power of our immune system, and they are less toxic than cytotoxic chemotherapy, and we are finding out that patients tend to generally do much better on these newer therapies. We're still learning about them, and they're not completely side effect free, but I think they'll be the future of hematology and oncology.
And what side effects would come with this?
So whenever we boost up the immune system, then we can expect autoimmune side effects. For instance, some people can have a very severe diarrhea, and that require actually steroids or prednisone, a kind of steroid, to treat them. And sometimes you can get lung inflammation called pneumonitis, and basically any kind of itis, which is an inflammation of different body organs, that can occur with immunotherapy. And obviously, when the patient is actually receiving the immunotherapy, they're watched very closely by our very well-trained nurses. So, because anytime any foreign substance is going into the body, some people have a tendency to have severe allergic reactions at that point in time.
You know, it's interesting. Another study that was out says that at this time, fewer people are dying from cancer than at any other time in our history. I mean, that is some good news to come out of this.
Yes, and we have accomplished that on the backs of standing on the shoulders of giants, and those giants are our patients and our people that the physicians who came before us, who gave us all this data. It hasn't been in leaps and bounds, but every year we're going in a trajectory of improving patients' life bit by bit. And I think if that trend continues, hopefully in the next few years, cancer will be like one of the what we call chronic disease, like heart disease, diabetes, hypertension. That's our goal.
I was looking at your bio just quickly before I let you go, and it says you enjoy watching TV shows.
Yes.
Which TV shows do you like to watch?
Anything that has a complex plot that is very close to reality. My all-time favorites was Breaking Bad.
Yeah.
Yes.
And so very good plot. And it was and that also shows the like that what we don't want to do gives us room for improvement for the healthcare system that the person was just trying to pay for his cancer treatment and provide for his family.
Think about that.
People forget about that, the plot of that show, that's ultimately what led him to what he ended up becoming.
All right, very interesting.
Family Guy?
Family Guy.
I could see it. He's a Family Guy.
I have to watch it alone. My wife might not let me see all of it.
Totally see it that he's a Family Guy fan.
Dr. Najan Dean over at Slocum Dickson, new to the area, and thank you so much for coming on. I think these advances that we're making, it allows us to live through these terrible things.
Yes, and hopefully we'll continue to improve on what we have gained. And at Slocum Dickson, we are a multi-specialty group, all the specialties under one roof. So we'll be serving the community for years on end.
Doc, thanks so much. I appreciate your time.